This animated video will give you a summary of the standard operating procedure, which is applicable for the second part of the Approach IS2 study. In summary, we want to give you an overview of the characteristics of the Approach IS2 study, Part 2. The research question that's being addressed in this second part of the study is to explore the profile and the healthcare needs of older adults with CHD, with a particular focus on investigating the frailty phenotype. In order to be eligible for participation in Part 2 of this study, some inclusion criteria are applicable. First of all in- and exclusion criteria for Part 1 remain applicable. However, we select only patients with a moderate to severe congenital heart disease who are eligible for participating in the second part of this study. So patients with a mild congenital heart disease are excluded. Furthermore, only patients who are at least 40 years or older at the moment of study inclusion are considered. Which are the data to be collected for Part 2 of this study? For Part 2, data need to be collected by the researcher based on two things. On one hand, we collect data based on the responses that patients give to a set of questions asked by the researcher using the data collection form. On the other hand, we also collect data based on the performance of patients on assessment tests that are performed by the researcher using instructions. Data collection consists of several components. First, we will determine or assess the cognitive functioning using the Montreal Cognitive Assessment Screener, or the MoCA, using a one-pager which is part of our data collection form. Secondly, we will determine the frailty phenotype using the method developed by Fried. Based on this method, there are 6 items that need to be collected. Items such as sex and age, weight, unintentional weight loss, exhaustion, and physical activity. Furthermore, a patient is also asked to perform a 4.1 walking speed test. A patient is asked to walk a distance of 4.5 meters, and we record the time it takes for a patient to perform this test. Finally, we will also determine the hand grip strength of a patient using the Jamar hand dynamometer. And thirdly, we will identify comorbidities using the Charleston Comorbidity Index based on medical chart review. If data are missing, additional information can be asked at a patient. So first we start with the assessment of the cognitive functioning of our patient. The cognitive functioning of patients with congenital heart disease is evaluated using a validated questionnaire or instrument. We will use the Montreal Cognitive Assessment Screener, or shortly said, the MoCA. The MoCA is a one-pager. For administration of these tests, one can use the official instructions that are developed by the MoCA. In case these official MoCA guidelines are available in your language, we provide them to you using the Approach IS Open Science Framework platform. Go to the Open Science Framework platform and look for the folder in which you can find the translations of questionnaires. There you can find, when they are available in your language, official MOCA guidelines which will help you administer this test. However, using the internet you can find more information about the administration and interpretation of the MOCA test. First of all, there is an official MOCA training. For people who are interested, you can follow an official training and certification program provided by MOCA. For more information about this training and certification, please check the website of MOCA. Go to www.mocatest.org and look for the training and certification webpage. Furthermore, on the internet, you can find a lot of instructions videos on how to administer the MOCA test. Some of them are accessible on YouTube, and we can recommend 2 particular videos. A hyperlink to these videos can also be found on the paper SOPs. A second part of our data collection is a determination of the frailty phenotype, by which we use the Freed method. First of all, you need to complete items 1 until 6 based on responses provided by patients to answers that you ask as a researcher. Items such as sex of the patient, the age of the patient, information about the current weight and body length, whether there is unintentional weight loss experienced by the patient over the past year, some questions about exhaustion, and finally also some items reflecting physical activity levels. In the data collection form, you can find 2 pages where items 1 until 6 can be found. Please complete all items. Furthermore, in order to determine the frailty phenotype, we also need to complete item number 7, which is the walking speed of the patient. Make sure you set up the test setting in order to perform this walking speed test. The setup is as follows. You can use 2 coins or any other object, but make sure the distance between these objects is 4.5 meters or 15 feet. No loops or turns are allowed. Instruct the patient to walk a straight line. The standard walking speed or pace should be kept in mind. So instruct the patient to walk at the same pace or speed at which he usually walks during daily life. If a patient makes use of walking aids in daily life, the patient can use these aids during the walking speed test. However, do not give additional support. In order to determine the walking speed, use a chronometer or the stopwatch of your smartphone to measure the time which is required to walk this distance. Write this time down in seconds on the data collection form. Finally, the last item that needs to be completed in order to determine the frailty phenotype is the hand grip strength. So item 8 is the hand grip strength test, which we perform in our patients. Measure the patient's hand grip strength using the Jamar hand dynamometer. This is a device which you can order online. There are some specific points of attention when performing this test. First of all, ask the patient to perform this test using the dominant hand, so either the right or the left hand. The patient must perform this test 3 times in succession. The unit of measurement which is used to express the grip strength is kilograms. On the device, you can read the values expressed in kilograms at the outer circle of the device, which is indicated on this figure in red. How can you perform the hand grip strength test? First of all, make sure that the patient performs this test in a standing position. Secondly, the patient should have the hand dynamometer in the dominant hand. The elbow should be flexed in 90 degrees and the wrist should be in a neutral position. Set the dynamometer to the second handle position because this is a standard position. However, if it's mandatory, adjust the handle to the patient's hand size. You can, for example, reposition the handle position. Rotate the red peak-hold needle counterwise to 0. As indicated on this figure, you will see this red needle. The red needle automatically retains the highest reading for a patient until you reset this. Now instruct the patient to squeeze the hand with maximal strength for 3 seconds. The patient should perform this test 3 times. Give 60 seconds of rest in between. Make sure you write down the scores of the 3 measurements on the paper and reset the red needle after each measurement. Finally, we will collect information on the presence of comorbidities in our patient. Whether or not comorbidities are present will be determined using the Charleston Comorbidity Index. In the data collection form, you can find also 1 page of information which you need to complete in order to determine which comorbidities are present in the study. Complete this index based on the chart review of the patient's medical file. But in case some information is missing, you might ask additional questions to the patient. If you have any questions about the data collection for the second part of the Approach IS study, please do not hesitate to contact us. Any questions or remarks you might have can be transferred to Liesbeth van Bulk. You can read her email address on this slide.